Hello, everybody. You are tuned in to The Local Lens, the podcast from the Powell County Health Department and Kentucky Rio, where we go inside our community's experience with the drug epidemic. And on this week's episode, we are finally taking a close look at the Powell County Jail. Now, we've talked before on this show how much of our jail's population is there for drug charges, and we've also talked about how often it is that run-ins with law enforcement end up pointing people to treatment. And we've even talked with Brad Epperson a long time ago about the substance abuse program in the jail that he helps with. But we have not talked specifically about jail and have not taken a close look inside the jail. Until now. We are joined today in this episode by David Howard, the head of the substance abuse program, and Neal Hamilton, who is the chief deputy of the Powell County Jail. And before we go any further, I would like to address something that has at least been on the front of my mind in working on this episode. Jails do get a very bad reputation, and I do think that there are structural changes that are necessary if we want to bring about any kind of real improvement. And I am not saying that there is no place for jails, because I think there is a very, very strong role that the jails do play for our societies. But these guys are being asked to do way more than they can handle. And they'll tell you that, and they're going to tell you that in this episode. So stay tuned. We're going to be getting into a lot of the issues that jails face. Well, thank you all for finding your way here. I hope you stick around for the whole thing. It really opened my eyes, and I'm glad I got to be a part of this interview. Well, let's go on and get into it then. I'm your host, Nate Brooks, and you are listening to The Local Lens. These are our people using our voices, telling our stories, because no one sees it like we do.
I'm David Howard. I am the program director here at the Powell County Detention Center for the DOC Substance Abuse Program.
I'm Neal Hamilton. I've been here 10 years. I'm the chief deputy, run the day-to-day operations of the jail, and kind of oversee everything.
And at this time, there were 303 inmates in the Powell County Jail. 100 of those people were there for the substance abuse program, which we will be calling SAP today. So additionally, in this jail, 96 of the 303 inmates are Powell County inmates, and the rest of them are from all over the state. So how big is this jail compared to other ones, like in our region?
In our region, this one here houses about as many as more than most around, because there's a lot of regional jails here. Montgomery County is a regional jail, Rowan County, Three Forks, they're all regional jails. They house for counties that don't have jails. So we don't do that here. We strictly have our county inmates plus state inmates that we have.
Okay, nice. And then you said you're the program director.
Yes.
Okay, so for the substance abuse program, I've heard that this is the largest substance abuse program?
One of the largest.
One of the largest. Okay.
I know it is on the eastern side of the state. I think there's one Christian county maybe, houses 100.
Yeah.
And I think there's a prison program, it's like 109. So
Yeah.
we're right up there. And a lot of those, because they do other programs as well.
Yeah.
But, yeah.
And then Brad Epperson is here, and we've done an episode with Brad about a year ago or so. I just like that guy.
Yeah.
Brad's a good guy.
Brad's been coming in here for years with us, with the guys on Fridays now. He comes in and he takes a little percentage of our guys and does little groups and classes with them and talks to them a lot. So, yeah, Brad's been a big help to us.
Yeah. So you said you get a lot of funding for doing the SAP program here. How much of a guy's time, if they're in the SAP program, is spent actually doing SAP program stuff?
Well, technically they're in SAP 24 hours a day.
Okay.
They live there. They don't mix with general population inmates. We have the whole new section of this jail, besides the segregation units that were built, was dedicated for SAP.
Okay.
Housing and classroom space.
Yeah.
So they really have a basic program hours of 7 o'clock till 4:30, kind of like another way to say the whole school day.
Mm-hmm.
They have things every day that's programmed in for time slots. We have a class schedule that they follow every day, Monday through Friday.
Yeah.
But even after hours, they're still SAP inmates. We expect a lot more out of them. Their behavior, their hygiene, their cleaning. So they're in SAP really 24 hours a day for the whole 6 months they're here.
Yeah. So how many guys do you have working on the SAP program too? Is it 100 people in the program, but how many workers?
We have staff.
Yeah.
We have myself, and then we have 4 clinicians.
Okay.
So there's 5 of us. With jail programs in the state, the Department of Corrections has a 20-to-1 ratio that we have to follow.
Mm-hmm.
So for obviously the 100, we have to have 5 staff, and that's where we're at.
Yeah. And we've already, before getting going, drew a couple similarities to the jail, Department of Corrections, and public education, and the 20-to-1 ratio also seems to be in the ballpark of what they try to shoot for. So how similar is corrections to Powell County High School down the road?
Well, I used to substitute teach, so I can tell you it's not a big difference. And I won't say which one it reminds me of, but I've done elementary, junior high, and some high school. But it's really kind of, to me, the same. It's kind of the same for the guys in SAT, because that's what they have is educational classes all throughout the day.
Mm-hmm.
Obviously, it's different, but it kind of reminds me of that. I'm sure on Neal's side it's a little bit different, where he deals with not the SAP stuff as much. Well, he does, but a lot more of issues. Let's just call them issues.
Let's call them issues. Let's talk about them.
Well, whenever someone gets arrested, whether it's drug charges, warrants, or whatever, they get brought straight here and released by the police department. Whichever police officer arrests them, or just as the peace that arrests them, they bring them straight here. They're released in our custody. A lot of times, if it is a drug charge, they're usually high. So, from the point where they start withdrawing until they come down off everything and get cleared out of our system, we're dealing with them daily, hourly, every 15 minutes, 20 minutes. I mean, 24 hours a day. We've got medical, we've got hygiene. Some of them come in here and they might not have bathed in a while, so we make sure they get cleaned up. We give them new jumpsuits. We do have t-shirts and underwear for people that's indigent. We get a lot of people in here that might not have undergarments. The females, we supply them with feminine hygiene products. Some of them don't use like they should. So we try to get them cleaned up, taken care of until they get back out in society.
And that is a job.
It is, because a lot of times if they are high, they really don't know what they're doing, might not be in their right mind. And you could come in here and say, okay, I'm going to tie you down, whatever. If you act out, you're going to get pepper sprayed or tasered, but we don't do that. We try to understand, for one, okay, we didn't do that to them, but yeah, they are high, they are acting out, they do not know what they're doing. So we try to take that into consideration instead of being hard. Is what I'd call it, hard on them. We try to talk to them, talk them down before it gets escalated.
Does that usually work before it gets escalated, or
80% of the time?
Okay. Yeah.
I don't pack taser, don't pack pepper spray. I couldn't tell you the last time I did have to taser somebody or pepper spray anybody. I can usually go up to them and reason with them and keep them from getting hurt and keep staff from getting hurt, and usually talk them down.
Yeah.
So, and we do get a lot of mental health issues.
Yeah.
A lot of them.
What does this look like here?
As far as mental health?
Yeah.
Well, you've got very minute training for mental health in a jail setting.
Yeah.
We usually try to get a court order to get them sent to Eastern State to get evaluated. It's very hard to do right now because Eastern State is shorthanded. KCPC, which is a medical facility, is very shorthanded. So you've got to become a counselor for mental health, a doctor, nurse. You've got a lot of roles you've got to fulfill in order to keep people safe, for one, and to keep the officers safe, and to keep other inmates safe from somebody that might act out.
And this is where we start to get into one of the biggest things that comes across in this interview, and that is mental health is causing such a strain on our jails. And these guys that work at the jails aren't necessarily trained to deal with that mental health. and it is really hard for them to connect people with outside help as well.
Then we do a lot of aftercare recommendations too, because that's really, for all the years I've been doing this, it kind of stinks that sometimes guys come to you and realize they need some help, and it's really not out there, especially for the mental health. And the best we can tell them is, hey, it's not we don't care, but we don't want to do any harm either, trying to go outside of where we should be.
Yeah.
Well, and so we would just say, hey, upon your release, we think it'd be appropriate to try to get, some kind of evaluation or something. And hopefully when they follow up in the community with their probation officers, I don't know how far you want to go, but like social service clinicians work in the probation offices, almost all of these guys meet with them when they go to their probation offices, and they know what's available in their community, where I wouldn't. If you come from whatever counties on the other side of the state, I would have no idea, but they do. Yeah. And they can see those recommendations in the CALM system, which is the Kentucky Offender Management System that we've put in there, and hopefully get them hooked up. It's not the greatest system, but like he said, there's just no resources hardly for mental health out there, especially for, maybe there is community, but for inmates, it's just non-existent.
Yeah. And remember that aftercare statement, because that's something we're going to hit on later on. But for now, let's get on back into the conversation. So, one thing I think is important to say is that there's only so much you guys can be expected to do. I mean, you hit on this several times. You're only trained to do specific things with it, right? And it takes a long time to go through the training where you would actually be able to be licensed to do all that, and then there's just overall shortage on stuff.
But with the way it is now, you have to be. I mean, you have to deal with it. There's no other option. You can't put them back on the street because they could kill somebody, hurt themselves, hurt family, and so we keep them here.
Yeah,
we've had a gentleman we had here since August that he would cut himself and write on the wall, and he would I could go back there and talk to him, he'd be fine. 15 minutes later, he'd be ready to kill half of them down the hallway.
Yeah.
And you couldn't put him in general population because it was constant fight.
Yeah.
So he had to be isolated by himself for 7 months. And we just did get him down to Eastern State for an evaluation.
Mm-hmm.
He's down there now. So, I mean, that's a long time for somebody to sit there and suffer.
Yeah.
And he needed help day one.
Yeah.
But that's how long of a process it took just to get one guy.
Yeah. Why does that process take so long? Is that just
red tape, not enough personnel at Eastern State? They have to accept them. Sometimes they won't accept them because of their charges. So if they've got violent charges, a lot of times they won't take them. So what do you do?
Yeah. Yeah.
Well, and I know for SAP inmates, it's state inmates, not just SAP inmates. It's limited. It's hard to get state inmates moved, and there is a hospital at one of the prisons that has a co-occurring program, but the best I can remember, it only holds 20 guys. So you're talking 20 guys in the state for incarcerated people.
Yeah, well, 300 people in this building.
Yeah, just in this building.
That's just this building.
Yeah. And they got a 20-bed program down there for state. So there's just, unfortunately, the jails, not just SAP, but the jails in general, every jail gets mental health is all over it. I mean, it's all over.
Yeah. The people don't get the help that they need.
Yeah.
No, not at all.
Why not? Is it really just a shortage of there being treatment? Yeah.
I think so. I don't know what else it could be besides the answer to everything is money. Yeah. I don't know if the money's not there for the programs in the communities.
We have people reach out all the time, but we can't help them because there's no resources there.
Yeah.
It's a statewide thing right now.
Yeah.
The legislative actually just passed some bills on this past session to open it up to do multi-state so they could get more professionals in here to work with it, mental health.
Hopefully.
Yeah.
Then you see funding going to things like, teaching, civil engineering, those are just the two that I'm aware of at least, that state will pay for your work and then give you a job for 4 years after you graduate and take care of you pretty decently. But there is a limited amount of money that's out there though, and that's just.
I think they really put a lot of money into substance use. I started doing this in jails back in 2005, and there's a lot more money in it now. There's a lot more programs obviously now. There's bed space, which is great for the substance use end of it. But and I don't know what the percentage would be, but whatever it is, it's pretty high that need mental health too. So yeah, we're dealing maybe with substance use, but are we really dealing with substance use if we're still not dealing with the mental health?
Yeah.
That's kind of where I think somebody, hopefully one of these days will, and I think they have a little bit, but I think it needs to go a lot further with the mental health.
Yeah, it'll take a long time to get that ball rolling
Oh, it will. I think maybe it's rolling. I won't say it's not rolling.
Yeah.
I just don't think it's rolling very fast. But
Yeah.
So hopefully it'll pick up a little bit. But I think they're really federal. I deal a lot with. We get a little federal money here. One of the only 2 jails that actually do get some federal grant money for our STAT program. I know the state is really, and I'm sure some of theirs come from federal funds. I think it's coming in. I know it coming in more than it used to. So hopefully, I don't know what the right answer is, and I'm not smart enough to figure out how we get, where we put them. Do we put them in jails? Do we put them in communities? How do we get guys from here to there? But hopefully the smarter people that know how to figure that out can get that rolling, because it's definitely needed. If you ask most people that work in this field, I think that's what they would tell you. I mean, I have calls from other jails all the time. I call my supervisor, and we have these guys, and it's like, well, there's really no good answer to ever give anybody what to do with them, which is a shame. When you see him like the one he was talking about, wasn't a SAP guy, but I know he's talking about, and he obviously needed help, and you reach out, and there's just nobody to reach out to sometimes.
So, yeah.
No, go ahead.
So correct me if I'm wrong on this, but it almost seems like the jail is just like a bucket. People end up getting dumped in here, and you're like, well, this is the best we can do here right now. And is that how it feels on your end?
That's how a lot of it is.
Yeah.
I think that's been that way. I worked in jails as like Neal did, but before I did this, when I was in college and stuff, and it's always just seemed to be that way.
Yeah.
When people didn't know what else to do with somebody, I'm not saying they didn't deserve to do something to be brought to jail, but then they just got left there.
Yeah.
And there was no help or, and
it's like, what do you do with them? Okay, so as a judge, if you order them somewhere, they can't take them because they have no personnel, no room. So the safest place for them is a jail. It's not ideal, but that's the safest place for them and the community, because if they get back out, they're just going to.
It's just like the guy he was talking about. If he would have got out, because he wasn't, as far as I know anyway, he can correct me if I'm wrong, he didn't have a felony charge. So he was here 200 and some days. We can only do 300 some max. What do you do with him even if he does it all? You just release him to the street, and then where does he go? The next day, they pick him up on something else, and he's right back in here again, and nothing was accomplished in a year. Yeah. And that's just one example, but that happens
and
quite a bit.
And it starts all over again.
Right.
Yeah, and I've heard a lot of people say that it feels like a revolving door type of issue.
Oh, it is.
And so you guys, you're both nodding along with that.
Yeah.
Well, even in substance abuse, I see the same guys I started with, unfortunately, a lot of them. And then even, I'm not even from this area, but a lot of the guys, when I hear them processing new guys in, I'm like, who'd they bring? And you know them, because it just seems to be the same guys over and over again. Because a lot of the problems, whether substance abuse, mental health, hasn't been addressed.
Yeah. It takes a lot to get that stuff addressed too, doesn't it?
Yeah.
Yeah.
It does.
So if you guys can make any changes to improve that, at least like not within just providing mental health services like more broadly, but like just within the jail system, the whole Department of Corrections, what would you guys?
I know from my end, I know they just created the new division, the reentry division, and I don't know once again how they could form it and make it work. But if they had somewhere, even though you couldn't maybe assign a professional mental health person to this jail because of the salary and money and all it would entail, but maybe where they come around, I don't know whether it be state, local, whoever would do it, but if there was some kind of mental health people that could come here and meet with people that maybe the clinical staff here has deemed could benefit from that. Mm-hmm. So I don't know how you would sort it out, but it would be nice if there was some way to have somebody come to the facility that's trained to deal with mental health, if we're still talking about mental health, and actually see, is this guy, because a lot of people outside of jails and prison haven't worked in, when guys act like that, it's always they're faking, trying to get out of jail. Well, unfortunately, that's not always the case. There's real mental health issues that need to be dealt with, and I don't know how else to do it besides bringing somebody here that's trained to deal with it, and knows the proper steps to take to address it.
I agree 100%.
So I've got a couple questions. First, is this do the guys working here, do they talk about the mental health being an issue much, like just the officers on the floor here?
Oh,
yeah.
Yeah, I mean, it's common knowledge because we communicate, each shift communicates with the next shift. Hey, such and such down here is acting out today. He might be having an episode, and that way nobody gets hurt. Everybody's communicating. Whenever you go down there to that pod or that cell, be extra cautious of this one or that one or or whoever.
Yeah.
But like I said, a lot of times people's got mental health. They act out and don't know what they're doing. I mean, and you can tell when we've been here, after you've been around it long enough, you can tell if somebody is truly acting out to get out of jail or has a legitimate issue.
What does that difference look like? I'm curious on that.
Their mannerisms. We know most of them that come in here, you can tell if this was deteriorated from here to, okay, now he's not talking or she's not talking the way I've known her to talk since I've known her or him.
I think a key too, I'm sorry.
Yeah, go ahead.
Is it almost, the ones that it turns off on command. And people dealing with real mental health issues not going to turn it off because you threaten to pepper spray them, because you threaten to put them in a chair. They're not going to stop because they don't realize what they're doing. A lot of these guys, you say, look, you don't stop, we're going to do, and they stop. It makes you wonder, That's what I notice the biggest difference is. Some of these guys, you can go, they can tase them if they need to, they can do it, and it doesn't stop because they don't really realize what's going on.
Yeah.
And the repercussions, we've had guys in our program that we found out through staff or other inmates is like walking around at night talking to people that ain't there with pencils in their hand, and it scares the other inmates back there. And and then when they realize, well, you're parole upon completion, which we can go into if you want later, but means they can get out of jail when they complete. You're going to lose your program doing that but they can't stop it because, and now if you just stop that all of a sudden quit doing it, that would probably tell you, okay, maybe not real mental health issues, because I think that's the biggest difference for me. It's like it doesn't stop no matter what the consequences are.
Yeah.
It just continues on and on.
We had a gentleman that actually was in SAP, and he had approached me and said, hey, I need you to put me in isolation. Well, nobody wants to go to isolation voluntarily, but he was enough to his senses to know he was having a breakdown. He was having a mental breakdown. He said, I need to be away from people, and I need to be by myself. He got to where he was urinating on himself. He would have bowel movements on himself and lay in it back there. We'd have to go back there and physically get him out, strip him down, clean him up. And he didn't sleep for a week. Up constantly. We checked every day. Hey, did he sleep any? No, constantly up. And that has an effect on your body too. So, I mean, he just progressively deteriorated right in front of our eyes. And we tried and and finally.
And I'll tell you another way too. They before they come here, they do the probation department does a pre-sentence investigation. They write a report that we can read, and it has educational sections, criminal, demographic things, and it has a mental health section. So a lot of times you can tell when these guys, if it's clear, then why all of a sudden did it just start when you've been in? And it could obviously, but a lot of them have. When you see certain behaviors, and then we go pull them up to see if there's something in their past, you can read those PSI reports that the probation has written and their mental health, and then it kind of sometimes clears that up. It's like, oh, this is why.
Yeah.
And then you have to go to medical and hope there's something, because I don't know all the limitations on medications and stuff jails can have. But, it says he was on this and on this. Well, now they're not allowed to have that in court. So, but at least it answers some questions sometimes when you read those reports.
Yeah. So this question, I definitely don't want to go too far into details on this. Just don't want to make sure there are any surprises on this. Funding for the jail, like that's taxpayer funded, right?
The jail itself or the program?
For the both.
I
Starting with
can
the
tell
jail,
you
but then also the program.
Okay, the jail.
The jail itself, I mean, it's taxpayer funded.
Yeah.
We get state funding,
Yeah.
which is taxpayer funded.
And it's decided by a budget crew
Yep.
in Frankfurt.
Yes, sir.
Yeah. Okay. Yeah, and then the SAP program?
The SAP program is the same way. They get state pay, which is for each inmate is funded $33 a day. Well, then they give us a per diem for each SAP inmate, which is $10 a day. Right, it used to be $9. Right now it's 10, and really all our 5 salaries come out of that money. Our operating, what we buy, all comes out of that.
Yeah.
So really, it shouldn't cost county anything in a perfect world.
Yeah.
But that's how the program is funded, is through that per diem that the state pays on top of the regular state inmate money.
And what this tells me is that if we are actually concerned with, 1, changing people's lives, and with 2, helping our society collectively become better, then this is something we should be paying more attention to, right? And before you even have the thought that this is their mess and they got themselves arrested, I want you to consider this entire drug epidemic that we've been in. And it's been crazy, and we've heard so many times, over and over again, how this just happens to everybody. And if we let it go unaddressed long enough, then it's going to get somebody really close to you at some point, if it hasn't already. But yeah, one more question for you guys then. So you said a couple times earlier that you can recommend that people go get connected with some kind of treatment, but you can't necessarily sign somebody up to go, like, you can't make the appointments for anybody. What kind of connections do you guys keep with people after they get out of jail, or is there any kind of connection outside?
I know for SAP there's not really, unless they contact us. But for us, what I was talking about, the social service clinicians in the probation offices, because they're the ones that would do it for our guys. We make recommendations when the counselors do their aftercare recommendations, and then when the social service clinician does that, they know what programs are available in that office, because the probation officers do a lot of different programs right there in that office on certain days of the week. Yeah. And they'll say, hey, you're required to do, and as long as they're on probation pro, they're going to do, because they don't, I'm sure that most of them wouldn't think they want to come back here. So for us, they do that, and anything in the community they want them to do, they will say, look, as part of your parole plan, you're going to do this course, you're going to come to my groups on Wednesday nights, or whatever. So I know for SAP guys, unless they're a serve out, they're still going to have something they have to follow by Department of Corrections, as far as aftercare and recovery things.
Yeah. Okay. So in next week's episode, we are going to be looking at a release program called First Day Forward that is going to be coming to Powell County and a lot of other places in our region. And that's a huge need, and we really need to be helping people get their feet back under them after they've been in jail for a while. But we will get there next week. Thank you all for tuning in to this week's episode of The Local Lens. It was so enlightening to me to be able to look at the Powell County Jail, and they even gave me a tour of the facility afterwards, and it's pretty astonishing just what these guys are having to handle. I think there's a lot of change that is needed in this area, and I think that these two guys for sure are doing the best that they can with what they've been given. But anyways, I'd like to give a big thanks to Neal and David for coming on the show and telling us about your all's experience working for the jail. That is what we're trying to capture with this show, because that is a very important perspective that you have to have if you're going to understand the full scope of how addiction affects our society. I would also like to thank WSKV for broadcasting the show, and also the Powell County Health Department and Kentucky Rio for sponsoring the show and letting it happen. And thank you all out there for listening. Please be sharing it with your friends. I really appreciate it. Well, I'm your host, Nate Brooks, and you have been listening to The Local Lens, where it is our people using our voices, telling our stories, because no one sees it like we do.